the good side of Treg is, you know, to downregulate inflammation, but there's a bad side that we all know about risk of infectious disease and risk of cancer development. And this is, I know, taken into account, but I would like to see how in the clinical trial you account for those possibilities, and is there any safety device that could help in that sense?
Tregs regulate inflammation, but inflammation regulates Tregs. Tregs work much less well in the context of high inflammation. This is why, in fact, we can mount immune responses against pathogens, because pathogens induce high level of local inflammation. If not, the Tregs will come and will actually cover the response. So it's really a balance, and what we do, in fact, is really a very mild stimulation of the Tregs. We're providing IL-2 for 5 days that will double the percentages of Tregs in patients, and then we have a maintenance treatment that actually increases Tregs by 30–50% over baseline. So it's not a dramatic change, and this actually does not affect how you respond to vaccination and infection. We've tested that in animal models and also in our clinical trials. Now, we have had many clinical trials over 1 year period of time for treatment. So we went through winters. Patients have had a lot of infections that have had a very basic normal outcome. So I don't think this is going to be an issue. For cancer, increasing Treg is not going to increase the risk of having cancer. If you have cancer and you increase the Treg, that may not be good. So if you have a patient with cancer, you will not stimulate the Tregs, and if the cancer does appear independently of the treatment, the patient is treated, you can actually stop the treatment.
Thank you.
I have a question for Iris. Could you make a comment on the relevance of using simvastatin in schizophrenia? In another word, is there any link between cholesterol metabolism and schizophrenia? Thank you.
Yeah, certainly. Well, I think simvastatin is a very interesting component because it not only decreases cholesterol synthesis, but it actually decreases the synthesis of many proteins and also of the pro-inflammatory proteins. So this component acts on many pathways. So for our patients with schizophrenia, many of them have metabolic syndrome. In the Netherlands, the prevalence of metabolic syndrome in patients with schizophrenia is 60%. I don't know about France, but in the United States it's even higher. So it's actually a very nice side effect that it lowers cholesterol. But a lot of the impact of simvastatin on cardiovascular mortality is not because of its lowering cholesterol ability, but rather because of the fact that it lowers pro-inflammatory proteins, and in that way lowers inflammation systemically in the arteries. Simvastatin is one of the statins that crosses the blood-brain barrier very easily. So it also decreases the inflammatory status in the brain. So that's the reason why we picked that one. So we will have decreased inflammation in the brain, which is our main target, and as a nicely welcome side effect, we'll have lower cholesterol.
I have a question to David Klatzmann. If there's any evidence for a link in a leaky gut and Treg insufficiency. So is there any change in Treg activation or maturation linked to maybe the microbiota regarding where they mature as it's close to the gut?
There is ample literature connecting the microbiota and Tregs. Not for the specifics of the question you're asking, I don't have an answer. But there is a clear connection between the Tregs and the microbiota. But you were talking about the leaky gut syndrome? Yeah, I don't have a specific answer to this question.
So maybe I can, if there's no more question, just spend no more than 2 minutes. So I'll be like the young presenter on some concluding remarks, which may be some personal and some general. Well, first, I think it was very interesting to see that over the last 10 years, there has been many changes of paradigm, and it's interesting to see that the two systems that have been presented here have a lot in common, and it's not surprising that they are at the forefront of those change of paradigm. The neurosensory system and the immune system have characteristics that makes them apart from all the other biological systems in terms of memory, in terms of education, and in terms of extreme diversity. I mean, they were all developed and actually during evolution and during also individual life to actually sense, and they are sensors of the external world, and they have also been developed to react. So this is why it's very important. And their crosstalk, although now we know there is a big crosstalk, could have been actually predicted on conceptual issue. The second point I want to mention is that Yehuda started by using Einstein quote about relativity, and I agree that everything is relativity. I'm not talking about his wife this time, but I'm talking about the general relativity theory. In the Einstein theory, I mean, there is one thing very important, is that if you change the point of view, so if you change the observer, which we are all the observer of that, I mean, actually, you change the paradigm and you change everything. And by changing everything, you actually redefine and re-stratify. And I know that psychiatrists use DSM. This is general semiology, actually, and basically, this is a convention. I mean, we all decide that there is a definition of a disease, but there's not such a thing, and several of you have already said that a disease can be new disease. We can create disease by using those views, and those diseases, you know, including comorbidities. I mean, there clearly this is a need, because what we have to take care of are patients, are individuals, and patients and individuals are slowly integrated themselves. And so an holistic approach is the only holistic approach. So although we use now precision medicine, I mean, I think we have to consider that precision medicine is just a marketing term that was used, but P4 medicine has probably more in-depth things in it to define what we are doing. We are doing prediction, prevention, personalization, and participative medicine in that. The last point I want to say in concluding remark is that there's been ample presentation here on epigenetic, genetics, and environment. And those are critical and those are very important. But it was alluded to several times. There is also the time frame. And I think since the immune system, the neural system are reactive and they react to environment, I mean, time frame is very important. And the dynamic of those systems has to be taken into account, probably from birth or even pre-birth there was a famous scientist that say from pre-womb to tomb. And actually, this is really what we have at some point to deal with. My final will not be a comment. It will be a thanks. My final remarks. Thanks to the organizer, thanks to Marion, thanks to Riyad, and thanks to Vincent, and also to the Inserm who has organized this meeting. And I think, Marion, we can all say, you would have said that this morning, we need a meeting next year, not in 2 years. Time goes too fast. And so we will have so much data, And this international cooperation is ongoing, as has been said, and really the landscape of psychiatry has changed, thanks to you also, and it will change even more in the future. And thank you very much.